If senators don't understand Facebook, how will they make sense of digital health? This is Bertalan Meskó, and you're watching the channel of the Medical Futurist. It was a magic moment. Mark Zuckerberg was summoned to the Capitol Hill to explain Cambridge Analytica and the fact that they harvested personal information from more than 80 million Facebook users to influence the US presidential elections. So what should have been the reaction of lawmakers? They should have squeezed Zuckerberg with tough questions and regulate the hell out of Facebook. What happened instead? Not quite that. Did you see the questions some senators asked? The one about how Facebook can sustain itself when it offers its services for free?
How do you sustain a business model in which users don't pay for your service?
Senator, we run ads.
I see.
That certainly stands out, but there were so many similar ones. I hope you were as angry as me while watching it. If senators don't understand Facebook, how will they deal with much more complex issues such as 3D printing organs, artificial intelligence, robotics, virtual reality or healthcare apps? How will they regulate digital health issues from including health sensors in the practice of medicine or using deep learning algorithms for diagnostics in radiology? If they don't get social media, how will they handle topics where human lives are at stake? Congressman, with all due respect, you have to get ready. Although technology is transforming our lives way faster than it should, you have to try to keep up for the sake of our future generations and the future of healthcare. Ask the FDA how they learn so fast about new medical technologies. Ask the community of digital health how they can help you. At the Medical Futurist Institute, we already prepared a policy report to give you the best practices in digital health. The important thing is to make the coexistence of healthcare and technology a viable one, and together we could live long and prosper.